Hello everyone, I'm Rul Mehta. I'm a rising senior at St. Ignatius High School, and I'll be presenting on what the best treatment options are for Nutcracker syndrome. So just like the action of a nutcracker crushing a nut, the syndrome refers to when the abdomen's aorta and superior mesenteric artery compress the left renal vein. Although it is a very uncommon syndrome, it is an essential diagnosis due to the illness, problems, and diseases associated with it. The absence of data and research regarding the management of this uncommon syndrome does pose a challenge for adequate recommendations of the best treatment modality. So my research focuses on the best treatment options for this syndrome. So Nutcracker syndrome is a rare vein compression disorder. It can cause many symptoms in both children and adults, such as flank pain and blood in the urine. The squeezing of the left renal vein can cause blood to seep backward into other nearby veins and make them expand as well. Although the Nutcracker syndrome is uncommon, it is an imperative diagnosis due to the morbidity linked with it, including the risk of chronic kidney disease from long-term left renal vein hypertension and the risk of left renal vein thrombosis. The treatment options may differ from specialist to specialist, but the most widespread type of surgery entails vascular surgery to ease the pressure on the left renal vein. Surgical treatment for Nutcracker syndrome can require relocating the left renal vein and reattaching it, or a left renal vein bypass. Multiple methods have been developed for the treatment of this disease. Conservative management instead of surgical treatment may be preferred in most cases. However, the rarity of the syndrome, the vacancy of data, and the short-term follow-up of the present evidence are the obstacles that prevent recommendations for the best treatment strategy. So we use the PubMed database to investigate the association between Nutcracker syndrome and treatment through vascular and endovascular surgery. And a total of 9 articles were found with information relevant to what Nutcracker syndrome is, case reports, how it is diagnosed, and how it can be treated. Our main goal is identifying common treatment options offered to patients and analyzing whether less commonly used procedures might offer the patient a better benefit. So several open and endovascular techniques have been described to treat Nutcracker syndrome. We present a case report of robotic-assisted LRV transposition to treat a patient with the Nutcracker syndrome. So the patient described in this case consented to the publication of this report. She was a healthy 19-year-old woman with a body mass index of 19 and a 2-year history of abdominal pain and microscopic hematuria without a discernible cause. A follow-up CAT scan later demonstrated worsening compression of her left renal vein by the superior mesenteric artery. The patient was discharged a day after the surgery. Her microhematuria was resolved, and she experienced an immediate reduction of her pain after the surgery. At her 1 week, 1 month, and 2 month follow-up visits, the patient reported a continued improvement in the frequency and severity of her abdominal pain. So the report demonstrates that robotic renal vein transposition can be a safe and effective technique for the treatment of Nutcracker syndrome. So the main goal of the open surgical approach is to correct or to improve the left renal vein compression. In addition to the open surgical approach, laparoscopic techniques have been developed as a less invasive option for the management of patients with Nutcracker syndrome. So the scholars evaluated the outcomes of 13 patients using this technique of laparoscopic extravascular stent placement. This technique included the placement of an externally reinforced expanded polytetrafluoroethylene graft of 10 millimeters in diameter, and then subsequently the graft was then bound to the surface of the left renal vein to prevent compression. Post-operatively, both duplex ultrasound and cross-sectional imaging demonstrated excellent blood outflow of the left renal vein. The endovascular treatment has been an appealing alternative to open procedures because of its minimally invasive nature. However, its major drawback is the lack of studies with long-term follow-up. The scholars treated 30 patients endovascularly. Their preferred stent was the SMART control stent, and technical success was achieved in the entire cohort without any complications. On follow-up, patient symptoms demonstrated improvement, and duplex ultrasound demonstrated the absence of stenosis, good flow, and patency of all stents. Furthermore, they evaluated the outcome of 6 patients treated with self-expandable stents, and after the procedure, they noted an increase in the diameter of the left renal vein and a decrease in the pressure gradient. There was no recurrence of macroscopic or microscopic hematuria. Duplex ultrasound and other cross-sectional imaging studies, including CTV and MRV, are necessary to demonstrate significant compression of the left renal vein. These have been key additional tools for the diagnosis of Nutcracker syndrome because they provide a quantitative assessment of the intravascular pressure and accurate size assessment of the left renal vein. Nutcracker syndrome is rare and its diagnosis remains difficult. Multiple imaging techniques are used to aid in the diagnosis of significant left renal vein obstruction, and duplex ultrasound is the least invasive and most reproducible. Management of Nutcracker syndrome can be conservative, observational, or invasive using endovascular or open surgical interventions. In most severe cases of Nutcracker syndrome, the doctor may suggest vascular surgery as the best option to relieve the pressure on your left renal vein.